let's talk about what's new in the 8th edition. So these are the changes between the 7th edition and the 8th edition. I'm not telling you to do or not do any of these things or giving recommendations. I'm just naming. This is also the new flow chart. They sort of adjusted a few things. So the change, they have added umbilical cord management. In the 7th edition, the 4 pre-birth questions were gestational age, is the amniotic fluid clear, how many babies, and what are the additional risk factors. In the 8th edition, the 4 pre-birth questions are, what is the gestational age, is the amniotic fluid clear, are there additional risk factors, and now umbilical cord management plan. No longer are they asking how many babies. Another change is the initial steps were reordered. 7th edition, they stated warm and maintain normal temperature, position airway, clear secretions if needed, dry and stimulate. And they sort of rearranged that in the 8th edition. They say warm, dry, and stimulate, position airway, suction if needed. Now, remember, they're doing this on every baby, on normal babies. So please, I hope you listen to my normal baby routine. Another change is the cardiac monitor is being recommended earlier. So in the 7th edition, they stated an electronic cardiac monitor is the preferred method for assessing heart rate during cardiac compressions. Now in the 8th edition, it states when an alternative airway becomes necessary, the LMA or endotracheal, the cardiac monitor is recommended for the most accurate assessment of the baby's heart. Now, once you start chest compressions, your pulse oximeter will probably not work due to poor perfusion. When you're doing chest compressions, you'll be using 100% oxygen. You can also, when you stop to assess heart rate, you can use your Doppler. I'm pretty sure you're not going to have a cardiac monitor in the out-of-hospital setting. Also, a cardiac monitor, when the heart rate is very low, can create electrical impulses which can give you a signal even if there's no heart rate. So, like on a very compromised baby. So it's not really recommended in the out-of-hospital setting. I suggest you use your Doppler. Another change, and again, I'm just reading the changes. This is not for the out-of-hospital setting. Epinephrine IV or intraosseous flush. In the 7th edition, they stated epinephrine with a 0.5 to 1 milliliter normal solution. In the 8th edition, they're recommending you flush with 3 milliliters normal saline. And this applies to all weights and gestational ages. And again, I'm just mentioning the changes here. I am not recommending usage. Another change with epinephrine, IV or IO, and endotracheal doses. So epinephrine and the endotracheal doses have been simplified for educational efficiency. The dosage range is unchanged. The simplified doses, whether it's IV, IO, and endotracheal, do not represent an endorsement of any particular dose within the recommended dosing range. So additional research is still needed. And then another change is expanded time frame for cessation of resuscitative efforts. Now, in the 7th edition, it was 10 minutes. In the 8th edition, it has been changed to 20 minutes before you could call death. But in the out-of-hospital setting, you cannot declare death. So this doesn't really apply to you in the out-of-hospital setting. If you don't have a heart rate, you should be calling EMS.